Is your child repeating parts of words, whole words, or phrases? It may be a sign of stuttering. Stuttering typically begins between the ages of 2 and 6 years. If your child was older than 3.5 years when they began stuttering, and your family has a history of fluency disorders, you may need to consult a speech therapist. Here are some exercises you can do with your child to make their speech less bumpy. Slow down technique. The slow down technique is exclusively for parents to learn and execute. As a parent, you need to slow your speech down and make sure that your child does not feel the need to talk fast every time they communicate verbally. Your unhurried speech will help your child understand that they have enough time to respond. It may give them the time to be more fluent. Using syllable-timed speech. In syllable-timed speech, you need to say one syllable at a time. Break up your words into syllables and put a brief pause after each syllable. For example, you need to speak like this. Each period is a pause in your speech. Introducing syllable-timed speech can reduce your child's stuttering by 96% in just 12 months, if applied properly. Demand less. For children who stutter, answering too many questions may feel frustrating. Asking too many questions increases the child's anxiety, which can increase their stuttering. Always follow your child's lead in conversations. Try to answer their questions. If you have questions, try to turn them into statements or simple yes or no inquiries. For example, instead of asking, "Hey there, buddy, what are you doing?" you can say, "Hey, I see you're playing Minecraft today. Awesome." Learning the verbal feedback technique. Sometimes children do not understand that their speech is bumpy. It is not necessarily bad, but for them to improve their fluency, they need to be aware of which speech model they should follow. So, every time your child says a particularly difficult word without stuttering, you can praise them with responses like, "Great job, no bumps at all." You can also ask them to evaluate their own speech. "Was that smooth?" And the child may respond, "Yes, it was." Make sure that most of your comments are positive only. Try to avoid commenting negatively on stuttered speech. An important message for parents. There is no magic cure for stuttering. You have to be patient and persistent with these exercises. It may take over a year for children to recover from childhood onset stuttering with regular speech therapy.